All right, well, good afternoon, everyone. Well, that was amazing, two speakers that we just had. Mr. Lee, amazing, just listening to his story and thinking about what I'm going to be sharing with you today, just a million and one thoughts going through my head. If I step away, can y'all still hear me? Okay, awesome. So, starting off, my name is Fuchsia Jenkins, and I am the training director with the Harris County Domestic Violence Coordinating Council. By a show of hands, how many of you are familiar with Harris County Domestic Violence Coordinating Council? All right, whoop, whoop, I see a few people. So just to kind of briefly introduce who we are a non-profit providing services within the domestic violence arena. What we do actually, though, is that we coordinate. We coordinate with other services. And as I listened to Mr. Lee and some of the other speakers, what we do is exactly what you just heard about, the importance of bringing systems together. And so we are based on the Duluth model for domestic violence response. And how many of you are familiar with the Duluth model? Now I'm really loud. Okay, so the Duluth model. And so a coordinated community response to domestic violence. And you may ask, why? Why would we want a coordinated community response to domestic violence? And so I'm going to throw the question out to you. I'm also interactive. Why do you think we need a coordinated community response to domestic violence? Yes, sir. I love that. So to paraphrase, if you did not hear him, so that survivors don't think that they are alone, that they have that support. So that's definitely a part of it. Anybody else? Why would we need a coordinated community? Right here, and then you on front, sir. Yes, ma'am. I love that. So she says to have people in your community who are helping you as you go through that process. And when you show up, it's someone who looks like you, right? Excellent. Yes, sir. Love that. A community approach, getting people involved versus people saying that's not my business. So all of those are excellent reasons. And then I do comma, and, based on the research that was done through the Duluth Project, what we know is that only about 33% of sexual assaults and domestic violence are ever reported. Only 33%. And I believe that last year there were about 42,000 cases of domestic violence reported. And if only 33% were reported, imagine how much domestic violence happened here in Harris County. That is mind-blowing. That is mind-blowing. And so part of that coordinated community response responds to the fact that only 33% of survivors are ever saying that this is what's happening in my life. However, kind of going back to what everybody has said in this room, is the reality is that we know that approximately 1 in 3 women will experience domestic violence in their lifetime. 1 in 3. Approximately 1 in 7 men will experience domestic violence in their lifetime. So here is the reality, what I often will put out when I'm sharing with people. That means that on an international basis, however, we're going to bring it back home to Harris County, that at any given time, about 40% of our residents in Harris County are living in an abusive relationship. Wrap your head around that. About 40%. And so if only 33%, and when we say reporting, we're talking about contacting law enforcement or contacting a shelter, because that's who we think should be handling this issue, right? It's the police's problem. It's the domestic violence program's problem. However, here is the reality. It is everyone's problem, as Mr. Lee so eloquently shared in his story. It is everyone's issue. And so who are the people who should be at the table? So when we talk about a coordinated community response, we're talking about bringing on our healthcare providers. And here's the thing, I started talking and I stopped using my thing. So let me go back and start following this here along because I get excited about this topic, all right? So an ounce of prevention is worth a pound of cure. So we're here talking about prevention, right? We want this not to be happening. I don't ever want another young man or young woman to share Mr. Lee's experience. And in 27 years of doing this work and hearing the stories that I've heard for 27 years, I was 12 when I got started, by the way, I don't want anyone to go through the experiences that I've heard about. So here's the thing, we should be focusing on prevention. So talking about primary prevention, I'm gonna come back to where I was, but we wanna lay this framework. So when we talk about prevention, we're talking about it in 3 levels. Primary prevention, number 1, is stopping the violence before it ever happens. Stopping it before it happens. And I want you to be thinking as we go through this session, how can you, in your role in that coordinated community response, stop sexual violence and domestic violence before it ever happens? Then moving into secondary, that is the prevent, reoccurrence, identify risk factors. So here's the thing, maybe we didn't get there in time to stop the violence from happening. However, now we have someone who's been in an abusive relationship. We have someone who has been sexually assaulted. What I want you to know is that 1 in 4 girls and 1 in 6 boys will be sexually abused or assaulted before they ever turn 18. So knowing that across our classrooms on any given day, right now, at some elementary school, some middle school, some high school, and yes, even a college campus, that maybe 25 to 30% of the people who are sitting in those seats has been molested or sexually assaulted. What do we do now? Well, by making sure they're getting access to therapy. What I know, 27 years of doing this work, is that so many times people never get the therapy. That I've talked to individuals. I remember the first time I went and I talked to a group of women that were all in their 70s. And a woman followed me to my car. She was 78 years old. And I remember being afraid of talking about sex because I'm from the old school that you respect your elders and there's just certain things you don't say in front of your elders. However, this woman trailed me to my car, 78 years old, and she looked at me and she said, "Thank you. Thank you for the work that you and your organization are doing." And she said, "I'm going to tell you something that I've never told anyone." And she went on to share with me how she had been sexually abused by the next door neighbor for over a 3-year period. 78 years old. And she had never said a word until that day. And she had missed the opportunity to get counseling, and she shared about how difficult life had been, okay? Talking about tertiary, this is, again, having support groups. So going also back to secondary, this is also where we can do screening. And I do a lot of work with healthcare providers and talking about the importance of doing screening for dating violence and domestic violence. So that when you go in for your well woman, and I've been trying to figure this out, do men go to well men exams? I don't know. Is that a thing? So whatever, so well woman, well man, your primary physician, one of the questions that you should be being asked is, so how's your relationship? Yeah. That's a screening to what? Be able to identify if that person may be in an abusive relationship. And then looking at tertiary responses, and that's where we get into support groups. Also, what we call BIPs. And how many of you are familiar with BIPs? And BIP is Battering, Intervention, Prevention Program. Battering, Intervention, Prevention Program. By a show of hands, how many of you are familiar with that? Okay, awesome. So you can turn to your neighbor afterwards and say, "Okay, girl, this is what she was talking about." But it's about holding abusers accountable, people who do harm accountable. So these are some areas of prevention. So now going back to Harris County Domestic Violence Coordinating Council and the importance of primary prevention, tertiary prevention, secondary prevention is bringing all the players to the table, bringing the systems to the table, because it is not solely up to law enforcement. Because here is the reality when it comes to domestic violence, that many of the things that are happening in an abusive relationship are simply unarrestable. Okay? And if you understand the dynamics of an abusive relationship, you recognize that name calling, taking someone's paycheck, not allowing them to have the pen, constantly telling them that everything's their fault. And there's a total of 8 tactics that none of those are things that law enforcement is going to pull the abuser away and put them in jail. Okay? So recognizing that, and also recognizing the fact that when it comes to our domestic violence programs, that unless the person makes the call, they're not going to get the service. And here's another side note, and later on in my slide deck, we're going to talk about what happens when a person finally does call one of those programs, okay? So who's at the table? Well, who's at the table are those of you who are in public health. You play an important role. Earlier on, we were talking about that there are the public health professionals who are going out into the community. That is important. So healthcare, we want healthcare at the table. Social services, that's going to be inclusive of all of our CPS, APS, those types of programs, adult protective services, child protective services. I had been asked earlier, were you going to use acronyms? All right. That alphabet soup just comes spewing out. So healthcare, social services, faith-based community. That's huge. No matter what faith that you may have. Corporate America, business, we want them at the table. Our judicial system, we want them at the table. So these are just some of our community partners that we work with, again, knowing that only 33% of survivors will ever call a hotline, that they will ever actually call law enforcement. A holistic approach. So when we talk about primary prevention, it comes at 4 levels. That is that individual level, where in order to do some prevention that we begin to, and I love what Dr. Temple was saying before I walked out, was about social emotional learning. Social emotional learning. How many of you are familiar with emotional intelligence? Really great stuff. And if you haven't looked that up, Google that stuff today, emotional intelligence. So part of that individual prevention. How? Because I believe that when we give our children a strong foundation, and even with the adults that I've worked with, when I started doing this work back in 1997, I remember that I came on as an employment specialist, and I thought it was going to be the easiest job that I could ever have. But about 2 weeks in, I thought, what have I gotten myself into? Because here's the thing, when you are helping people to get a job, to be employable, what do people need in order to be employable? Skills, and what else? Because you can have all the skills in the world, but what else do you need? Experience. Was this on the front row? Education. How about believing in yourself? Self-efficacy. You can have the best product around, but if you don't have the ability to show up and say, here I am, it does you no good. So how many people are out there who have excellent skills, however, they do not possess the most important quality is knowing how to love myself, knowing how to speak up for myself. So at the individual level, are we creating a society where our children love themselves? And I believe that we are not doing that on a regular basis. So at the individual level, what is the foundation that we are creating? At the relationship level. So again, talking about preventing violence, because going back to the individual level, that if I love myself, I am less likely to harm others. There's the old adage that says that hurt people do what? Hurt people. Come on now. So if I can love myself, if I can have mercy and grace with myself, it is much easier for me to have that mercy and grace with other people. So that becomes a preventive measure for preventing dating violence, domestic violence, and sexual violence. Then moving into the relationship. This looks at who is it that you are exposed to. It's often said that if you are in a room with 4 other people, so 5 people, and that everybody's wealthy, guess what? Number 5, you're next. However, if everyone else in that room is engaging in behavior that is sexual harassment and things of those natures, guess what? You're probably going to be the 5th abuser in that room. So who are you surrounding yourself with? So looking at the relationship level and teaching conflict management skills, teaching our youth and adults about the importance of things such as empathy. Then moving down to community. As a community prevention source, it is about all of those stakeholders at the table taking responsibility and saying, you know, I'm a nurse. I don't do domestic violence advocacy. Well, I'm going to push back on that because I got a call from a nurse about 3 weeks ago who had went through one of the classes that I taught, and she just wanted to make sure that she had did everything right. And as she went down the list, she did the danger assessment. She went through and she educated the patient about the power and control wheel. She was able to direct them to the next resource. And I said, what you say? You have just been promoted to head domestic violence advocate. And yes, it was a part of her job. Why? Because it was a part of that woman's health. So, at the community level, are our healthcare professionals up front and center talking about the issue of relationships? In our communities of faith, I just did an online program for the African Seventh-day Adventist Church. And 51 people from here in Houston and Nigeria on a Zoom call. And just the response and the pastor saying, this will be required of all our parishioners to listen, all our congregants to listen to. Why? Because they are seeing an increase in violence happening in the relationships. So very often when people are in communities of faith and they go to their pastor, they go to their priest, they go to their imam, that they are told, go back home. That is your role as a woman. So, community, to do prevention in the faith-based community. With our businesses, our companies being committed as a community partner. Do they have domestic violence in the workplace policy and procedures? There's an organization called Workplace Response, I believe, workplaceresponse.org, and they actually have sample policy and procedures for the workplace. So as you sit here today, here is a challenge to go back to your place of employment and ask, do we have a policy and procedure on domestic violence in the workplace? Well, why do we need a domestic violence policy and procedure in the workplace? We'll ask the family of the woman who was gunned down in front of a credit union in 2021. After leaving her husband, and he had swore, the video actually went viral. He goes, I'm going to kill you. And he followed her to work and shot her in the back of the head. She falls to the ground, and he empties the clip. That is not an isolated incident. According to the coalition of Corporate Association to End Partner Violence, when they interviewed security guards and asked them what were their top 10 concerns in the workplace, domestic violence ranked. So community partners coming on board, because guess what? Just because she or he goes to work does not mean that the domestic violence remains behind. In fact, work is going to be the #1 place that the person causing harm will look for the survivor, okay? So that's some of the reason for community. I'll add one more to the list, education. And then we're probably gonna be able to skip through the rest of these slides because I've talked about everything on there now. With education, and again, I really admire Dr. Temple. He's done some amazing work. He has a program actually called the 4th R that they take into schools, I believe 7th through 12th grade. And that 4th R is about relationship. So in talking about schools being a part of primary prevention is asking, for those of you who have students who are in, I'll just say K through 12. How many of you have children in K through 12? How many of you are familiar with something called Title IX by a show of hands? All right, for those of you who didn't raise your hands, I want to encourage you to look up Title IX. And if you have students who are going into college for the first time, then under that Title IX piece is also something called the Campus Save Act. I believe that just recently, DAIA, who provides services predominantly within the South Asian community, that in fact, tomorrow, I believe or was it last Wednesday, they did a workshop called the Red Zone. How many of you are familiar with the term Red Zone? Red Zone, I believe, is at the beginning of the fall semester, and we know that is when most college young women will be sexually assaulted. Yeah. And so we need our education front and center to do primary prevention, talking about what constitutes a healthy relationship. That no, it's not healthy, as one 16-year-old sat in front of me at the office on Lockwood as I was doing an assessment with her and sharing with me how she had stopped seeing all of her friends because her boyfriend, she was 16, he was 17, and he had begun to push all of her friends out of her life, and she had to ask for permission for a sleepover, to sleep over at her friend's house. Not her parents did she ask permission. She asked her 17-year-old boyfriend. And all night long, she said, he continued to call me. And finally, he said, we're going to have to FaceTime, and I need you to show me everybody in the room. So she's at a sleepover filming. And if your daughter was there, your daughter was on that video. So when we say it doesn't apply to me, come on now, it applies to you. Because every young girl in that bedroom that night was on that video to prove to him that that's where she was. And so when schools say that that's not my issue, the reality is that we have students who drop out of school. There was a young woman who actually lost her life in school, which is how we got the teen dating violence bill that was passed in September of 1991, I believe, and I may be off on that date. However, her boyfriend stabbed her to death in the hallway. So yes, it does matter if schools are on board. And then moving down to societal issues when it comes to prevention, asking ourselves that as a society, and again, going back to Mr. Lee, he was riveting. I truly enjoyed that presentation. Looking at some root causes, looking at those things called oppression, looking at sexism and how that is the root of 1 in 4 girls and 1 in 6 boys being sexually assaulted or molested. Looking at the root of individuals, that there is hate crime because of gender, orientation, sexism. Here's a quick story about sexism. And again, we're still having this conversation about prevention and what can we be doing as a community to prevent domestic and sexual violence. I stood in front of a class in 2019, didn't know COVID was a-coming, right? And here's the thing, though. At that point, I'd been doing this work for 25 years, and so it wasn't a response that I was not used to. However, I was going through the dynamics of an abusive relationship, and a young lady at the back of the class, she raised her hand meekly, and she said, "Miss, what if your boyfriend doesn't want you to go to college and you received a full scholarship? What if your boyfriend gets angry because you don't answer the phone every time he calls?" And sitting next to her was a gentleman whose jaws began to tighten. He began to grind his teeth, and he began to turn shades of pink and red. And I think when he got tired of her asking questions, he finally said, "I'm the man, and I will decide where she goes to school." This is the mindset, and again, I want to keep going back to Mr. Lee because he did that. That is a mindset. So we're talking about preventing this crime, and yes, we are talking about a crime. We're not talking about teasing people. We're not talking about, just people acting out, as my grandmother would say, they just acting a fool. No, we're talking about a crime before it, quote unquote, becomes a crime. That this is what that young man's response was: "I am the man." And I'm assuming he was about 17 years old, but he had a mindset that because I am the male in this relationship, I will decide whether or not she accepts a full ride to a university that could change the trajectory of her family, that could move them out of poverty, because she said, "I will be the first person in my family to ever go to school. I will be the first person in my family who will have opportunities." And so here's a bigger question for us to answer today, is that there are individuals out there that we are losing: doctors, lawyers, nurses, teachers, because of this insidious crime called domestic violence. We have a problem. Raise your hands if you think we have a problem. And it starts, I believe, with how we show people how to feel about themselves, and it also starts with what we allow. That when we allow that little boy who cries, and we say, stop crying, act like a man, you punk. When we allow that behavior that happens even in our own homes, I was that mother. I didn't say the punk part, but what I did say, I would say, boy, why are you crying? Act like a man. You boys don't cry. And I had to go back and say, no, that's not okay. Because here's the thing, with a boiling pot, and this is not in any of my notes, but I'm hoping that this is helpful, is that if you get a boiling pot, what will eventually happen to that boiling pot when you put a lid on it? It will explode. So we have to ask ourselves as a society, what are we doing to help people to even manage their emotions, going back to what Dr. Temple talked about, the social emotional learning, and also about how we are doing gender socialization. And this is not about debatable things. This is simply saying, I appreciate you for who you are. That part. Looking at the roots of poverty. Asking ourselves, what is the price that we are paying for poverty? As the young woman who sat across from me a few years ago, and she had to make the decision as to whether or not she would have intimate relations with the person who was causing her harm. She had lost her job as a waitress, and she had to decide about getting diapers and formula and food for her babies, and she reaches out to the person who is responsible for these children and ask them very simply, can you give me some money so I can go get diapers and I can go get food? And the response was that I will give you the money for the food, for the diapers, if you fill in the blank. And watching a woman cringe and cower and say, I am so embarrassed about the choice that I made, but she made a choice to feed her children. That is the price of poverty. And then linking that back to domestic and sexual violence, that we know that probably approximately 50% of women who are in abusive relationships, that will shift them into homelessness. How, you ask? Well, even if she's making $100,000 a year, there's something called coerced debt. How many of you are familiar with the term coerced debt? So coerced debt is when your partner maybe gets credit cards in your name. They may force you to sign for a mortgage, for a car, whatever the case may be. And then we also have economic abuse. So that person who's making $100,000 a year, because I also want to dispel the myth that the only people who are at risk for crime are individuals who are in certain zip codes. There are people in gated communities who are at risk of crime and even more likely not to report it because of the stigma. So are we even outreaching to the gated communities? Are we outreaching to the Ivy League schools in our community? Or are we only focusing on the ones that we know are on their way to jail, quote unquote? Are you with me? So that correlation between poverty. So I may make $100,000 a year. However, here's the reality. I probably only saw about $25,000 of that to begin with, because direct deposit was to my partner's account, and I don't even have the PIN. So when I leave, and I am used to having an income of $200,000, because I had 100, they had 100, we got 200. But guess what? When I walk out of that door, I am likely to have only the $25,000 or zero. I've worked with the women. I've worked with the men. When they left out of that house, even though they had good education, they had good skills, when they walked out of that house, they had nothing but the clothes on their back. So homelessness, poverty. And then think about the people who live in generational poverty. We're saying, why don't you leave? Why can't you do better? Well, if I am depending on that person like that young lady who had to make a decision to basically sex traffic herself in order to meet the needs of her children. Okay? I think I pretty much covered that. How am I doing on time? Good, all right. So I've sort of covered all of these right here, talking about the education component, about why we want schools on board, the medical, we've had those conversations, law enforcement. bringing law enforcement to the table. You know, when I first started doing this work with the Harris County Domestic Violence Coordinating Council, I've been with the agency now going on 7 years. It's hard to believe it's been that long. However, when I came to the team, and also to talk about the work that HCDVCC is doing for prevention, and let me do a pause here, and, that our total mission are these three things. Number one is to increase access to safety and services for survivors of domestic violence. We want that woman or man to be able to have access to services. And so many times, people have no idea. I worked for a domestic violence agency for 19 years. And it never surprised me that when I went into a room, that people who literally lived down the street from the shelter had no idea that it existed. That there are people who have no idea that Houston Area Women's Center exists. There are people who have no idea that Bay Area Turning Point exists. So we want to ensure that that survivor, as someone in this group says, so that person knows that they're not alone. We want them to know you are not alone, which is why it's so important for law enforcement to know what the local crisis centers are, why it's so important for the person who works at the local health clinic to know what resources are available, like that nurse I spoke to 3 weeks ago, for the local school, for that teacher to know what services are available, for ABC company to know what services are available. That's prevention. It may not be primary at that time. At this point, it's going to be secondary. However, we're stepping in that moment when that survivor needs help. Okay? So that's key. And then, so starting when I started doing this in 2015, I had the opportunity to work with, out of the family violence unit with our local sheriff's office. And I love, again, what Mr. Lee talked about, how that for those of us who are in social services, and I'm going to say the medical community, the business community, is that we should have some understanding, not necessarily experts in the judicial system, not necessarily experts about parole versus probation, and I'm going to raise my hand, and I'm going to say that that is not in my lane. And what I realized, he convicted me, because I said, you know what, I need to know more. Currently, I am doing training with the probation office, and what I stopped and did at the last training is I said, you know what, I need a better understanding of exactly what you do, because I didn't realize how vast it was, because I had spent the last 3 decades in victim services as it relates to domestic violence. And sometimes we allow our pride to get in the way of collaboration. So as I sat there at 601 Lockwood, many of the myths and the stereotypes that I had about law enforcement and their response to domestic violence and sexual assault were dispelled when I actually had the opportunity to sit amongst them. And that is part of primary prevention, tertiary prevention, secondary prevention, is we have to learn how to talk to each other. We should all be saying the same thing. I may not be the expert in it. However, I can give enough information that I might be able to interrupt the violence and save a life and to change the trajectory of a generation. We need to learn how to talk to each other. Going back to the 4 T's, and I hope I don't mess them up. Taking the time to talk, to be transparent, and to trust. That's what it's going to take. And that's what the coordinated community response to domestic violence is about. All of us coming together at this violence prevention and learning what other people are doing, because there are some great and mighty things that are happening in Houston and surrounding Harris County. In fact, give yourselves a round of applause. There's good stuff going on up in here. However, we're not taking the time to talk to one another. We're not taking the time to see our services through someone else's lens, okay? So law enforcement, very important. So to sum that point up, that with law enforcement, recognizing, as I said to you, that in most cases, there's not going to be an arrest, because no one's going to go to jail, most likely. There's terroristic threat, I'm going to kill you. That might kind of get you put behind bars. However, the reality is that if you eat one more Twinkie, you're going to need your own zip code. Your partner ain't going to jail for that, people. They're not going to jail for that. They're not going to jail because they tell you you don't know how to cook. Somebody in the house might even agree. You're not going to jail for that. However, those are tactics that abusers use to take away the survivor's ability to have control over their own life. So, no one's going to go to jail tonight. However, I am going to write this report as a law enforcement officer. And I am going to refer that to the victim advocates at 601 Lockwood so that that victim advocate can now put a call out and say, Ms. Jenkins, I understand that you had a call for service at your home last night, and I'm just calling to make sure that everything's okay. Would you like to come in and to meet with me? Well, I can't get there, and I don't have anyone to watch the kids. Oh, so, however, if you were able to come in, would there be things that we could help you with? Well, and then they start going on. So maybe we coordinate and we meet you, because those are some of the things that I did. I would actually go to that person's side of town, not to their house, but if there was a McDonald's, guess what? I would go to the McDonald's, and they could walk to that McDonald's, and we would sit and we would talk about a safety plan. Because no, it hadn't got to the point that they had been physically assaulted. It hadn't got to the point that their partner had been arrested. However, in that McDonald's, they saw someone who was willing to take time to come to that McDonald's and have a conversation. They walked away with resources. That's how law enforcement can be a supporter. Not necessarily arresting, but what? Getting that survivor in contact with services to step in to interrupt that violence and hopefully prevent it from occurring again. We talked about corporate and small business. So here's the thing. We all have the opportunity to make a world of difference, as cliche as that sounds. And, many times we'll say, well, I can't help everybody. As I was talking to a group of survivors last night, we are now starting a speakers bureau for survivors because we believe and know that it's important. That it's one thing after 27 years that I could probably talk to you about domestic violence until midnight tonight. However, here's the reality. For someone who has gone through that experience, for them to share, we believe that that is key. So we can make a world of difference. So here are some innovations that are happening with the Harris County Domestic Violence Coordinating Council as we talk about prevention and working with all of our partners. And here's the thing, we cannot do anything without the law enforcement teams that we work with, without the domestic violence programs that we work with, without the healthcare providers that we work with, without the schools that we work with, without the faith-based communities that we work with, without the work that is being done through our criminal justice. It is about all of us coming together and being able to see each other's work through different lenses. So housing. Housing is extremely important. And what I want to share about that is that in 2019, October of 2019, and I can put this down, in October of 2019, the Texas Council on Family Violence, and how many of you are familiar with Texas Council on Family Violence? Write that down. Great resource. They've got some online training that you can get. Someone was asking me before I came up about resources for training. They have just a plethora of online training, so I would encourage you, tcfv.org. So Texas Council on Family Violence came down and they did a presentation. And in that presentation in October of 2019, what they talked about is that when a survivor, and this was based on research that they had done, when a survivor made that decision, and I want you to realize just how hard that decision is to reach out for help. Going back to Mr. Lee, it's a mindset thing. If that person can push through the mindset of what is happening in their life, they finally make that call. What Texas Council on Family Violence shared, and it wasn't news to those of us in the domestic violence shelter movement, that there was a 75% turnaway rate. That was in 2019, people. 5 months later, COVID-19 came. And the world shut down. Domestic violence agencies shut their doors for their safety. All the world did, right? And we were told in about 2 weeks, all would be good. And in those 14 days, do you think that domestic violence and sexual assault stopped? It increased. And when the doors did finally come open 2 to 3 to 4 weeks later, those shelters were operating at 50% capacity. What was the turnaway rate in October of 2019? Talk back to me. 75%. So what do you think happened in March of 2020? And what continues to happen August 30th, 2022. Okay? So with that in mind, Oh, I thought you was telling me 5 minutes. With that in mind, some of the innovative work is that we as an agency, we receive funding, and especially at the beginning, receive funding. I believe that in my notes I was saying that close to 250 families were housed in the last 2 years. Okay? Because what we recognize is that in order for the violence to be interrupted and to stop, potentially stop, is that the survivor has to have a safe place to be. Housing is necessary. It's easy for you on the outside, well, I don't know why she just don't leave. I don't know why he just don't leave. Well, maybe you've never slept in your car. Maybe because of the isolation, you don't know what it's like to call your mom, your father, your sister, your cousin, and for them to say, oh, now you call me? I ain't heard from you in almost 2 years. So are they going to allow you to come in their house? And on top of that, we know that the average survivor will leave and return 7 to 11 times. Oh, you just going to leave again? We went and got you an apartment, got it all furnished, and you let that idiot back in the house. No, we're not going to help you. I talk real talk, people. And that part. And that part.
And maybe you're not married to a cop, but when the cops come out, they take sides with the abuser and they chump it up, and then, yeah, they work against you. That's what I told.
All right. So all that part, all of that. And again, I could be here till midnight, and I know some of you are saying, ain't nobody got time for that. I just need you to know that this is a much bigger topic. It's a bigger topic than 45 minutes when we're talking about prevention, because there are so many factors. However, hold on to the fact that housing is one of those main factors. What we have seen is that we have seen survivors be able to flourish when they actually have a place that they can come to at the end of the night and call home. I was sharing with someone earlier about adverse childhood experience. By a show of hands, how many of you are familiar with adverse childhood experience? Well, we know that being homeless is one of those traumatic events that has long-term effects on a child's life into adulthood, right? So not only are we talking about the survivor, we're talking about the children connected to them. So housing is important. Secondly, domestic violence high-risk team. So here's the other part that we know is that when the survivor makes the decision to leave the person who is causing harm, that they are 75% more at risk to be murdered. So another part of the coordinated community response, I share with you that number one, it is to provide access to safety and services for survivors. Number two, hold batterers accountable. And number three is to prevent homicides related to domestic violence. So this domestic violence high-risk team is about holding the person who causes harm accountable, and it's also about preventing homicide related to domestic violence. In 2020, 228 Texans lost their lives at the hands of an intimate partner. 228, 65% of those were with a firearm. So when you are telling that person to leave, the person causing harm, we are literally ushering them into the hands of death. Yes, they need to leave. It is better that they leave. It is better that they have a life without violence. However, we also have to understand the risk associated with that. So the domestic violence high-risk team, and I'm very happy to say we just received an award for the work that we have been doing. When I say we, that is not just Harris County Domestic Violence Coordinating Council. It is the district attorney's office that we are working with. It is with several law enforcement agencies that we are working with. It is with different healthcare communities that we are working with. That's what I mean when I say we recently got award for the work that is being done here in Harris County. So the domestic violence high-risk team, what they do is they assess a person who is a survivor of domestic violence. And there's something called the danger assessment. By a show of hands, how many of you have heard of the danger assessment? If you have not, please write that down and visit dangerassessment.org. Dangerassessment.org. It is a tool created by Jacqueline Campbell, Dr. Jacqueline Campbell, who is with Johns Hopkins University. And it is a prevention tool. It is a prevention for homicide tool. Because at the end of the day, we are talking about a crime, and the end result of this crime is murder. Period. And so it is a list of 20 questions And law enforcement are being trained on what's called the Danger Assessment for Law Enforcement, known as the DALE. So it is 11 questions. Some of the questions that are on there, number one, and this is answered within a 12-month period. So these are things that if you are a healthcare provider, if you are working out in the community as a public health servant, and you are having a conversation with someone, and they're like, well, yeah, my relationship's a little, they're a little crazy. Oh, well, tell me a little bit more about that. Oh, so wow, you say you've been in the relationship for about 2.5 years? I'm just wondering, have you ever left them? Oh, have I left them? Oh my goodness. And you say, well, how many times have you left them in the past year? Oh, I left him, I left her about 4 times. That is a point on that danger assessment. Yes.
So, and I think we got 3 minutes left, right?
Oh, I'm sorry.
And I wanted to ask a question before we got out.
Yes, sir.
So, talking about sexual assault, my name is Roshan. I'm the organizer and director for the Peer Justice Organization. Talking about sexual assault, it hits me kind of hard, right? And I stand with survivors. But how do we hold young men? How do we protect our young men from people that lie about their age? And how do we hold people accountable that abuse laws with falsehoods? Because holding abusers accountable is key, right? So if we stand with victims of sexual assault, we must stand with those from false accusations, because that is widely underreported, because people refuse to correct their wrongs. And once you get sucked into that system, it's so hard to talk about your situation, because everybody prefers to demonize you instead of listen to you because of the accusation. And that accusation ruins lives.
And I totally agree, just on the other hand, as those who are survivors of domestic and sexual violence. And so here is the reality, and I would love to have a sidebar conversation with you. I will answer the question the best I can at the time that I have allotted, because I hear your passion, I hear your heart. That when I go back and I talk about the oppressive issues, the issues that go on in our lives, we can go back and talk, especially in communities of color, where there are individuals who have served time after time after time. There's a warrant out for a woman who would not take her word back, and a young man lies in a cold grave, okay? So I will not dismiss that. So that gets into a whole nother construct, and I hear your heart. However, here is the reality, and I often get questions along that line. When a person finally says that I am a victim, I'm going to say that there's probably an 80 to 90% chance they are a victim. Now, are there times that people will use that crime as a tool for power and control? Yes, sir, without a doubt. So, what I believe is talking about getting back to healthy relationships is, I think so very often, and we're going to do a wrap-up here about preventing dating violence and interrupting generational violence. I totally hear you, and I think that that's a conversation that warrants probably a whole nother 45 minutes, is the work that is being done through Title IX. That when our college students are first stepping on campus for the first time, there's something called consent. And I learned this from a law enforcement officer / therapist. And he said, there's 3 ways to have sex. Y'all want to know the 3 ways to have sex? Yeah. Number 1 is agreement. You want me, I want you. Then there is a little thing called coercion. Well, if you don't, somebody else will. I'm going to send your parents this nice shot that you sent me if you don't. The 3rd way is force. I believe not only is it our young people, it is old folks like me at 56 that we have not had conversations about what true consent is. And I hope that that's not falling on deaf ears. Again, not taking away, because that becomes a whole nother, I don't want to say a whole nother, but getting into vendettas, and it also can be a part of the cycle of being in an abusive relationship, that my man wouldn't do what I told him to do, so I'm going to call these people on them. That could be a part of that. I recognize that. Totally get that, will not deny that. That's when we get back to having an understanding of the dynamics of an abusive relationship. And then stepping back, and I will let you have the floor as I get ready to close out, is that I think the biggest part of primary prevention, and I'm going to go back to my deputy at the back. I love what you all shared at your session. about time. We have to create the time to talk about this very personal issue. And again, 45 minutes, we don't even crack the surface. We have to be willing to have the time, we have to be willing to talk and willing to hear both sides out, being able to see through a different set of lenses. We have to learn transparency, that yes, there are false accusations made, and those false accusations within the construct of even an intimate relationship can be, I was sexually assaulted. Yes, it does happen. And then trust, that we have to be willing to trust all the people who come to the table. And I will turn it to you as I get ready to relinquish the mic. Yes, sir.
This kind of dovetails with what this gentleman spoke of earlier. You mentioned that housing is one of the main components to a successful separation from a domestic violence situation. The last thing you touched on was probably, to me, in my opinion, the most fundamental thing, which is healthy relationships. What if you have a case, this is a hypothetical, what if you do have a case where there's a family structure that is divided, but maybe they really want the relationship to work? Most of what I hear about these conversations is, girl, you need to leave him. He ain't no good for you. Vice versa, when they're actually demonizing the family structure or the household structure, when you do have situations that occur in families where shit is the fan. Let's just say that. But that doesn't mean the family doesn't want to be together, right? So what is being done in these programming situation models of actually trying to reunify and unify the family together? So many times I hear to separate. And a lot of times what I see in the black community and the brown community is that, yeah, some domestic situation occurred, right? Something happened. But then you'll have a person totally take advantage of that situation. I can get free housing. I can get free this. I can get free that. How long do you sustain this separation?
I'm coming down.
And what are you doing to keep families together?
I think that probably this needs to be a part 2. So here's the thing. No. I love this. I live for this. Because had I had more than 45 minutes, that part, talking about the tertiary response, and this is something that Barbie and I have been talking about for about the last year and a half. I did a online workshop. I'm missing Zoom. I like seeing y'all in person, but I gotta tell you, I love me some Zoom, because see, girl can have a little bunny slippers on and my little pajamas and then just kind of be blinged out from the waist up. So I'm missing that. I did, talking about black and brown communities. I have a son, 31, and we've had lots of talks about, if it gets deep and heavy, and if I don't care if, anyway, so we're not gonna go all the way there, but we've had those conversations. However, the conversation that we've been having and really wanting to get more into the prevention space, that we've just gotten a grant that will allow us to go into schools and start having these conversations. So number one, the domestic violence programs are not about tearing families apart, period. If you want to stay with him, her, that's all about you. What we do want to do is give tools. And we cannot dismiss that 228 people died. We cannot dismiss that. I try to stay, not to listen to the news, that I think Mayor Turner was talking about a woman who was shot within the course of one weekend. I remember 3 women were killed in a weekend, in 48 hours. Gunned down, beat down. We can't dismiss any of that. So do we want anyone to stay in that type of relationship so that we can then apply for crime victims comp and have $4,500 sent to the local funeral home? That part. So what we want to do is provide the tools to assess. And here's another thing that I've been sharing with people, and this is Athesha opinion, not my agency's opinion. The only person who can keep a survivor of domestic violence safe is the abuser. And because we know only the abuser can do that, I believe that we need to be having more conversations with you and you at the table. And here's the thing. I did a program, again, before COVID. COVID just came and messed everything up. It was February, Black History Month, and I thought, I'm gonna do something for Black History Month. I'm the training director, so I wanted to get the people at the table. And I think I had about 8 or 9 people who came, and it was 3 men. A man contacted me. He saw the posting on Eventbrite, and he's in the rap industry. And so, my son, he's an up-and-coming rapper person. And so, anyway, so that becomes a whole nother issue about the lyrics, okay? Because if y'all heard that, I'm a snatcher. Oh, my goodness. I did a Google on that. Oh, my goodness. Okay, anyway, keep focused, Thesha. And he said, well, I work with young men. I help them get into the rap industry. And so immediately my bias, because we talk a lot about bias when it comes to race and ethnicity, but we have a whole lot of other biases, people. And so my bias did come up, and I thought, this rapper talking about, somebody bouncing and all that kind of stuff. I don't know what they come to my thing for. And finally I was like, stop, take the time, talk, be transparent, and trust that something told him he needed to be in this space about Black love. That was the name of the workshop. He showed up, him and his 2 friends, in my heavens. All 3 of them, they sat there and they cried. They talk about witnessing their own mothers be abused. And even one came forth and said, I realize I have been abusive to my partner. And here's the thing. That doesn't mean that he's a bad person. It doesn't mean it. And that's the other part. I love Brené Brown, that we take one incident of a person's life and we determine who they are. I don't think there's a person in here who has never made a jacked up decision. Everybody keep looking straight ahead at it. And so what we believe is that with the person who causes harm, with the person who sexually assaults, because we also know that is sometimes generational. That little Joey who sexually assaults someone, guess what? Little Joey is that 1 in 6 that never got reported. And that now becomes normal behavior. So it's not about demonizing men or women. It's about having the opportunity, whether you're with public health, whether you're with healthcare, whether you're with corporate America, whether you're with business, whether you're with the local Sunday school or the local Muslim group, and stepping in and talking about healthy relationships. And here's the thing, we've been talking about healthy relationships and domestic violence and sexual assault prevention with women for 40 plus years. Guess who we haven't been talking to? Yeah. And so I believe that we all have to come to the table to have this conversation, because that is true prevention. And that maybe we could even prevent some of the falsehoods, because sometimes the only power that a woman may think she has. And here's the thing. This is not about right and wrong. This is about not demonizing. This is about human behavior. Human behavior. And let's face it, sometimes we do not behave well. And sometimes we don't behave well because of our own past traumas, that I've learned that I can't get you with my hands. I can't get you with this, but I'll get you with that call saying you did X, Y, Z. Now, does it stop the ruin of someone's life that they now can't get an apartment? No. However, we have the opportunity. We have gathered here together to do prevention. We can't spend a whole lot of time looking back. We ain't going there. What can I do today? And it takes both men and women coming together, having this conversation, as difficult as it can be. That is the power of prevention. And this is a topic that for too long we have not been willing to talk about. It has been the shh. So I may not have answered your question. However, I think that this is a comma and conversation. All right? And they're probably going to send the Sandman out here in about 1-2 seconds. But you've been raising your hand like... So go ahead, and if you need to move around, move around. I thank all of you for taking time to be in this session. I hope that it was of value to you. Yes, ma'am.
When it comes to verbal abuse and this physical abuse, and somebody that has talked about that or reached out to people, because I've suffered it and dealt with that, I hear when I talk about the verbal abuse, or I see all the rolling of the eyes and the, again, with the same attitude of that's just verbal, grow up, you know, da-da-da-da-da. But have you seen any strides that have kind of helped it just isn't out there, I think, or talked about as much as everything else?
When we talk about the dynamics of an abusive relationship, words are powerful. You know, there's an old book that says that our world was framed with words. And if you subscribe to the theory of neuro-linguistic programming, emotional intelligence, I'm reading something. I had a mentor. She's 13 years old. She's 15 now, and she schooled me. My daddy always said, "Baby, you're never too old to learn, and don't question who you learn from." So this little 13-year-old girl, she gonna tell me she's doing a report on epigenetics. I said, "Epi what?" And she schooled me. I know about that much. How about reading a new book by Dr. Carol Leaf? It talks about the power of epigenetics and about the words that we speak, and coupling that with the trauma. So if I am saying, I am stupid, I am ugly, I'm never gonna be anybody. You know, no one cares if my daddy or my mom is coming into my room doing bad things to me at night. Yes, I'm stupid, just like my mom or my uncle told me that if you're constantly saying those words, it actually will begin to reshape your DNA. And that it can have lasting effects of up to 4 generations. Your great-grandma, your granddaddy, your daddy, and you, the words coming out of our mouth. And when we know the fact that about 40% of people living in Harris County are either in an abusive relationship, been sexually assaulted, molested, what becomes the program that is going through their head? And so you may say, who could do a false sexual assault report on someone? Someone who's got some jacked up DNA. Come on now. And there's other reasons for that. It could be just being downright mean and vindictive. Hurt people. If you have a chance, I always forget the name of the guy who wrote the book, The Body Keeps the Score. Excellent book, depressing as all get out. I bought it for my sister. She's a nurse practitioner. She called me and she goes, "I'm going to beat you up." Because y'all want to listen to that mess. That's too depressing. But it's an excellent book. And I would encourage you to look more into epigenetics. I'm doing more, because when I read that passage about it can impact up to 4 generations, I thought about my own thoughts. This is not a good place in here sometimes. I thought about my own words and how I have impacted my son and how I may have impacted even my grandchildren to come. Yes?
So I was a former educator, and actually if you put water into a jar and you like write the words on the jars or have like students speak to it, they'll see that the water molecules will actually begin to change. And so the jar with the positive words will remain clear, where the jar that has been spoken to negatively will actually become like a brownish dark color. It is insane to witness, but it is.
That's the power of words.
In a nice way and positively versus talking negatively to that plant, another plant. The plant that you spoke positive words of affirmation and positivity to will outflourish and grow the plant. And just word, vibration of words.
And so I think a good way to end this is to ask you as service providers, what words are you speaking over your clients? Everybody have a great day.